Hello, and thank you for invitation. Of course, it's very hard to speak after Susan, but I face on it. First of all, statins are not vitamins. Are you agree with that? It's treatment. It's drugs with side effect. So when we are talking about also before for all today morning presenters speaking about choices, that women should have choice and women should decide by themselves. So also I remember before the lunch that Susan mentioned something about it also, that it's the choice of women. So it's obvious that it should not be mandatory treatment and it's not for all. And somebody of you also asked for whom. Are we talking about all women living with HIV should have statins or just some? Which one? What about pregnancy? It's also not on the data because pregnant women cannot take statins because of the risk. So we exclude quite a big group of women who are during the life want to be pregnant. And of course, everybody knows that most women do not predict when they will be pregnant. Am I right? The group was speaking about sexuality. So that's the reason I have some of course, argument more about it. So, first of all, lack of straight science evidence for universal benefits, what was mentioned before by Esteban. Of course, there is a lot of potential drug interaction between antiretroviral treatment, so not all women can take it, and there is a quite big group, especially pregnant women, that are excluded from the statin very quickly. Other thing is that higher risk of side effects in women, and even today I was talking with one woman, I will not show with whom, but she takes statins 3 months, and after side effects she decided not to take it. So it's also discussion about adherence, because again it's not a vitamin. So if you break the treatment, what happened with your body? What is the reaction of your body? And of course, it's also, we should talking about mental health, and women with HIV often manage multiple health and social challenges. And it was also mentioned today that very often women are not adherents for antiretroviral treatment because of the social issue, mental health, and other activity that they are taking during the life, and the health, it's very often the last point when they are concentrate on it. And as we always talking around HIV, medical treatment must be individualized. So we cannot mandatory statin. It's a choice for women if they would like to have it or not, and why they should have it. And it's also ethics and patient autonomy. So I decided about my health. I had to have all knowledge about it before I decided if I should take it or not. And it's also about communication with my doctor, why I should have it, and if it's necessary, it's our decision. But first of all, it's my decision that I would like to have these pills. So, you know how to vote now.